How do HSV-1 and HSV-2 differ in genital herpes? When it comes to genital herpes, many people wonder about the differences between herpes simplex virus type 1 and type 2. Both viruses can cause genital herpes, but they have distinct characteristics. First, let's talk about where these viruses typically cause infections. Herpes simplex virus type 1 is most commonly known for causing oral herpes, which leads to cold sores around the mouth. However, it can also cause genital herpes, usually through oral sex. On the other hand, herpes simplex virus type 2 is primarily responsible for genital herpes, infecting the genital and anal areas. Next, let's discuss how these viruses are transmitted. Herpes simplex virus type 1 is often spread non-sexually during childhood, typically through saliva or direct contact with oral sores. Genital infections from herpes simplex virus type 1 occur mainly through oral sex. In contrast, herpes simplex virus type 2 is mainly transmitted through sexual contact, including vaginal, anal, or oral sex. It spreads through contact with genital or anal skin, sores, or fluids. It's important to note that both viruses can be transmitted even when there are no visible symptoms, but the risk of transmission is highest during active outbreaks. Now, let's look at how often these infections recur. Genital infections caused by herpes simplex virus type 2 tend to lead to more frequent and recurrent outbreaks compared to those caused by herpes simplex virus type 1. Many individuals with genital herpes, regardless of the virus type, may experience mild symptoms or may even be asymptomatic, meaning they carry the virus without knowing it and can unknowingly transmit it to others. In terms of how common these infections are, herpes simplex virus type 1 is widespread globally, with around 64% of people under 50 infected, primarily causing oral herpes. Genital infections from herpes simplex virus type 1 representing a smaller portion of cases. Conversely, herpes simplex virus type 2 genital infections affect about 13% of people aged 15 to 49 worldwide and are more strongly associated with recurrent genital herpes symptoms. It's also noteworthy that women are infected with herpes simplex virus type 2 at nearly double the rate of men, largely due to more efficient transmission from men to women. Both herpes simplex virus type 1 and type 2 establish lifelong infections by remaining dormant in nerve cells and can reactivate over time. The diagnosis and treatment for genital herpes caused by either virus are similar, focusing on antiviral medications that help reduce symptoms, outbreaks, and the risk of transmission. Knowing which virus type you have can provide insights into the likelihood of recurrence and help with counseling on transmission risks. In summary, while herpes simplex virus type 2 is the main cause of genital herpes with more frequent recurrences, herpes simplex virus type 1 can also lead to genital infections, usually acquired through oral sex, and tends to recur less often. Both viruses can be transmitted even without symptoms, highlighting the importance of safe sexual practices and consulting with healthcare professionals for proper diagnosis and management.